Welcome. Today we will tell you about the international history of occupational health. Now, let's start.
In the 2000 before Christ, in Mesopotamia, social security aspects are seen in the legal code created by King Hammurabi. In the year 1000 before Christ, in Greece established a society of economic and social slavery. Century 4 before Christ, Hippocrates, father of medicine, described lead poisoning as an occupational disease. In the year 100, Gaius Pliny describes a number of occupational diseases in the Encyclopedia of Natural Sciences. In the year 162, Gallets included and writes rare comments and diseases due to occupational exposure. In the year 645, the first legis normas were established in Italy to protect workers for work accidents. In 1453, Bureau of Public Health. In the 1473, the Dr. Rollenbach indicated that the values of some metals such as mercury are dangerous and so the preventive measure. In the 1567, the first monograph dedicated to occupational diseases is attributed to Paracelsus, a Swiss physician. In the 1567, the fever epidemic in the Manchester Cotton prompted the first government security action. In 1802, in England, the first law relative to the health and morals of apprenticeship in the inspection of industrial plants was passed. In the year 1818, in France, the first legislation on the protection. In the 1850, the first fighting system was implemented by Frederick Greener in the United States. In the 1866, the Geneva Works International established the conquest of 8 hours of work. In 1868, in Germany, the Workers' Compensation Laws appeared. In the 1892, the first Department of Industrial Safety was created in the United States. In 1898, efforts were made to help and prolong responsibility for workplace accidents. In 1911, the state of Wisconsin passed the first law regulating workers' compensation. In the 1912, in the Salvador legislation is passed on work accident and professional rights. In the 1908, in the United States appeared the first school that grants a diploma in the industrial hygiene. In 1941, calculation of frequency, severity, and accident for are made. 1970, in the United States, occupational safety and health become what they called the most comprehensive safety law ever passed.
In 1973, entry of the UK into the European Economic Community, initiating the requirement for the UK to implement European Directive on Health and Safety and Discrimination. In this same year, Health and Safety Executive Employment Medical Advisor Service became operational. In 1978, Faculty of Occupational Medicine is created within the Royal College of Physicians. In 1982, the Royal College of Nursing publishes the Education of the Occupational Health course. In 1992, the Association of Occupational Health Nurse Practitioners, UCA, is founded with a goal to increase the representation and profile of occupational health. In 2000, Health and Safety Commission Security Health Together 10-year occupational health strategy is launched. In 2004, Commercial Occupational Health Providers Association is launched. In 2008, publication of the called Black Report, Working for a Healthier Tomorrow. In 2009, Council for Health and Work is formed with an independent chair. In the same year, NHS Health and Wellbeing, the Burman Review, is published. In 2010 is launched Safe, Effective, Quality Occupational Health Service, a set of standards and a voluntary accreditation scheme for occupational health service in the UK. In 2011, Royal College of Nursing publishes Roles and Responsibilities of Occupational Health Nurse, and 2014, Peer for Work Service is launched.
Good afternoon, this is our timeline of the history of occupational health in Colombia. In 1904, Rafael Uribe was the one who spoke about safety at work, proposed a bill on accident at work. In 1915, Law 57, known as the Uribe Law, was approved. The obligation that every company or economic sector should provide medical and pharmaceutical assistance and pay compensation to their workers. In 1921, Law 37 established groups life insurance for employees. In 1935, labor legislation was established and work risks are discussed. In 1938, Law 53 on the right of the protection of pregnant women and 8 weeks of paid leave, and Law 96 with the creation of the entity today known as the Ministry of Social Protection. In 1945, Law 6 established the legislation on occupational health, in which the first law on occupational health standards appears. In 1946, Law 90, the Social Security Institute is created with the objective of providing health and pension service to Colombian workers, and the Colombian Society of Occupational Medicine was founded. In 1950, the Substantive Labor Code is used, with which multiple standards related to occupational health were established, such as working hours, mandatory rest, benefits, and amongst others. In 1964, Decree 3170 approved the compulsory social insurance regulation for work accidents and occupational diseases. In 1979, the term occupational health is born and Law 9 is given, which was the government's first real approach to the protection of worker health, and in the Article 81, which states that the health of workers is an indispensable condition for the socioeconomic development of the country. In 1983, Decree 586 created the National Occupational Health Committee permanently to design and coordinate occupational health programs.
1993 Law 100 Comprehensive Social Security System. Law 1295 of 1994 established the general system of professional reg is defined as the set of norms and procedures destined to prevent, protect, and attend to work from the effects of illness and accident that may occur as consequence of work. Resolution 2318 of 1996, which regulates and delegates the expedition of occupational health license for natural and legal persons. 22. Law 76 Organization, Administration and Benefits of the SGRP and Obligation of Reinstatement. 23. Decree 280 Affiliation of independent workers with civil, commercial, or administrative cancer contract with natural or legal person. 25 Resolution 156 regulates the report formats for work accidents and occupational disease FURAT and FUREP. 27 Resolution 1401 regulates the investigation of incidents and accidents at work. 2015 Decree 157 Term of Inserted Intermediate in Occupational Risks. Decree 2059 Monetary Compensation System in the General System of Occupational Hazard. 2016 Decree 1170 Requirement to have a doctor and a lawyer to register as an insured intermediary in occupational hazard with the Ministry of Labor. 2070 Decree 52 repealed the PSOB. The AST indicates the base of the execution.
Thanks for your attention.